Welcome, everybody, and thank you for joining 2021 AEP Benefit Preview for Anthem Blue Cross and Blue Shield in the state of Indiana. My name is Jason Sword. I'm the manager of broker sales. And first and foremost, I want to say thank you for a great 2020. I know it's been very challenging. Without the broker channel and having such a successful 2020, we wouldn't have the products that we're going to have in 2021. So thank you for all the production and all the support. We're going to dive right in. First and foremost, I want to introduce you to the local staff in the state of Indiana that supports your broker channel. As I said, my name is Jason Sword. I am the manager of broker sales. We have 4 RSMs, or regional sales managers, 2 recent promotions, well-deserved for Lisa Oberbrockling. She was previously an ASR, as well as Wes Rayleigh, and obviously I think everybody probably knows Craig Rubel and Roy Mickish. We're in the process of hiring 2 brand new ASRs to fill Wes and Lisa's old positions. So we will have a staff of 7 local people to help you in any of your ventures or anything that you need support-wise for Anthem. So as our product strengthens, our client base strengthens, our staff is growing to help support the broker channel. And then obviously take note of some of the resources down below, some phone numbers to maybe jot down. I would just basically recommend that you have Medicare agent sales support. They can get you in touch with any other phone number, any other department. DSNP eligibility hotline to call and check and see if your members are eligible for that DSNP product. Take that number down. Obviously, if you want to check a decent sized block, or if it's not of an urgent matter, you can email at medicaideligibility@anthem.com. So take those numbers down if needed. A little bit of housekeeping for 2021. I want to go over some changes on our vendor list. The majority of them have stayed the same. Obviously, we're sticking with Liberty Dental for the dental network. And as far as the PERS, it will still be CST, but they were acquired by Best Buy Health. All the contacts and everything will stay the same, but you may see Best Buy Health. It is not a new vendor. It's still CST. Best Buy Health just acquired them. Sticking with Silver Sneakers, Hearing Care Solutions, GA Foods, SoluTrain for Walmart OTC benefits, but a lot of the customer support has been moved in-house to Anthem, and you'll hear a little bit more about that later. And our transportation benefit, which was previously Logisticare, is now switched over to Access to Care. Vision, sticking with Blue View Vision. Something brand new for 2021 that is going to be able to help a lot of your clients. I know from my time in the field, there was nothing worse than running into a member that was in kidney failure, end-stage renal disease, and you could not offer them a Medicare Advantage plan. So for 2021, anybody with ESRD is eligible for all of our plans. We are not going to have a chronic plan designed specifically for ESRD, but they are eligible for any one of our plans. I wanted to touch a little bit on live health just because of the COVID environment and a lot of things. We have seen a big uptick in the utilization of live health online. That will continue. I will say I have utilized this personally. I was not a firm believer until I did try it. I came down with a cold, and instead of actually scheduling an appointment and going to my doctor, I just hopped on live health online, and they were able to prescribe me some medicine to run down to my local pharmacy. So saved me a lot of time. I know a lot of seniors are scared to go into the doctor's office, but they still want to consult with their physician. A lot of physicians have their own platforms, but we also offer live health online. So if any of those things happen, they can connect with a physician via live health online. That has expanded to have psychology, and I think that's available for 15 hours a day, but the live health online doctors are available 24/7. So I just wanted to notate that. Probably important when you're talking to your potential members this upcoming AEP that you mentioned live health online, just because of the challenging circumstances we're in. Some improvements. I know that everybody on the call today knows that Anthem has dedicated a lot of resources to explosive growth. Now we're starting to reflect and really try to improve the member experiences. In the past, we've had a couple hiccups and a couple issues that have been sorted out, like the OTC and a lot of different things. So let me kind of go over some housekeeping things there. Member welcome kits, they should get those 7 to 10 days after the application has been approved. So that's not when you submit the application, that's whenever it has switched over to the approved status in your producer toolbox, your members should receive a welcome kit 7 to 10 days after that approved status is updated. The member ID cards will obviously still include the PCPs. You obviously want to make sure that your client ensures that the correct PCP is on there. If not, to give you a call as the broker. The helpful phone numbers will still be listed on the back. Member services, that's the first number listed. If they call member services can get them connected to all different departments. Pharmacy member services is going to be listed on the ID card, and also silver sneakers. And one other good tidbit about silver sneakers this year is they are not required to have their silver sneakers card to go into a location at a gym. They just need their member ID with silver sneakers. So that's a good improvement. I know a lot of that stuff is shifting over to the phone, or people can save it in their notes and then just give the number when they go to the gym. As far as the OTC, they will receive that 4 weeks after the enrollment date. And as always, those OTC Walmart cards are preloaded just like a gift card. Those allowances are loaded automatically at the beginning of every quarter. Those benefits do roll over quarter to quarter, but they will expire at the end of the year. So you want to make sure your member uses it up before the end of the contract year. But those amounts will add on to the previous quarter amount if it was not utilized. So one thing to keep in mind is you want to make sure that your clients are running those as gift cards when they go to the physical location. I know we've had some hiccups in the past where the cards weren't working, and a lot of that has been fixed by running it as a gift card. And something brand new to 2021 that I'm excited about is our Care Guide welcome call. It's very important to, once your member has been sold and they've signed, that we touch base with them. So some interesting facts is 50% of new members call customer service within the first 90 days, and 40% of all disenrollments happen within the first 90 days. So, taking those stats into account, Anthem has decided that we're going to do we're going to outreach to them. It's going to be about a 20-minute phone call just to make sure that they understand the plan that they signed up for. They understand the benefits. If we need to double check any doctors or talk about the way the OTC works, any questions that they may have as a follow-up to the point of sale. So that'll be a good thing. It should help your clients be a little bit stickier and less disenrollments before they actually go into place. So that's a great improvement for Anthem for 2021. I'm excited about that. So hopefully that helps your clients become stickier moving forward. Our PDPs for 2021, not a whole lot of changes. We're going to stick with the standard, the plus, and the enhanced plans. There has been a little bit of shifting in the premium, so take note in that. As far as the enhanced plan, you notice that Tier 1s are now going to be $0. Last year they were $1. And there has been some improvements on the standard copay structure as far as Tier 1s and Tier 4s. So just take note of that. Not a whole lot of changes there. Some great new additions to our preferred pharmacies for 2021. As you see the list on the right-hand side that has the new next to it, those are new for 2021. Some notable things in the state of Indiana, I would say, would be Myers, Publix, Costco's, and obviously we haven't lost any. Walmart, it doesn't matter if it's a neighborhood market, your CVS, Kroger's, all of those that have been preferred in the past. Our Tier 6 remains intact for 2021. Not a whole lot of changes there. Remember, if your client has an Anthem Medicare Advantage plan, there is Tier 6 that's available, and that's a $0 copay on all the medicines you see listed on your screen. Doesn't matter if they are preferred or a standard pharmacy, and that is in person. So it is not required that they do mail-in. And this is just kind of a map of Indiana showing you that we have HMO and D-SNP plans available. Border to border, we offer products in all 92 counties in the state of Indiana. We are introducing a new low-premium local PPO in a large footprint, 70 counties to be exact. So that's exciting. We'll get to that, and we'll go through the benefits there here in just a minute. We are still maintaining a wide product portfolio ranging from products for age-ins and general enrollment populations to those with LIS and dual-eligible special needs. Our dual SNP plan is going to remain one of the strongest in the state. So we have expanded our emergency worldwide coverage limit. It has increased from $25,000 to $100,000 on all plans. Our network includes key providers across the state, such as IU Health, which we landed a few years ago, and then our most recent victory was Parkview. We did reach a long-term deal with Parkview, so another great win for our network in the state of Indiana. We're currently only missing one hospital network, and that is Reed Memorial in Wayne County, but I'm going to talk a little bit in the show here about how we can overcome that challenge this AEP. So we have had some enhancements to our HMO products as far as the MOOP and the outpatient hospital copays. We're still keeping a lot of the rich supplemental benefits and essential extras and OTC returns, so those are good things. And obviously, as I said earlier, we do continue to have a market-leading D-SNP plan. First, I'm going to scan over some of our existing PPOs that were available in 2020. Not a lot of changes to our PPO products that were existing clients. We do have that addition of the new one, but that $29 local PPO that was up toward the Fort Wayne area, no changes at all to the plan, $29, no shifts in the benefits whatsoever. The other local PPO that spans throughout the majority of the state, except for those counties listed below, going to remain $54. MOOP stays unchanged. None of the benefits have been affected. So we still have that $54 PPO available. It will return for 2021. And then, of course, the regional PPO product that's been available for umpteen years, not a lot of changes to it. The premium has gone up to $84. So if you have members still in those plans, you may want to look at some of the local PPO options available in their counties to maybe reduce some of that premium for them. But that PCP copay did go down from 15 to 10. And there's been a little bit of a shift on Tier 3. I think it went from $45 to $37. And that product is available in Indiana and Kentucky. No other changes across that product other than the two that are listed in green. Now, the new PPO product, I want to cover this in depth because I think this product can really help a lot of your seniors. If you notice, it is $16. And the key thing that I want to note on the $16 premium, all that has been listed under the Part D portion. So if you have a member that is receiving LIS, the premium will be $0. The state will pick up that $16. Remember, $0 if they're on LIS. That's a huge win. And you notice that I said earlier that we had a way around the Wayne County Reed Memorial Network flaw. This plan and this product is available in Wayne County. So if you have any clients up in that area and you haven't been able to sell them an Anthem product that they want, now you have a $16 PPO if they're on LIS, $0 PPO to help them with their costs. The max out of pocket on that plan, $4,900. PCP $5, specialist $40, inpatient hospital $370, but it is only days 1 through 5. RX deductible of $125. That's not on tiers 1 and 2. That's only tiers 3 and above. The copays on tiers 1 and 2, obviously $4 and $13, and that tier 6 allocation does apply to this plan. If they're on those really generic medicines, it will be $0 available for your clients. It is listed in these counties, and it's 70 counties to be exact throughout the state of Indiana. Skilled nursing, obviously, days 1 through 20 will be $0. Outpatient surgery at a hospital will be $350 copay. Ambulatory surgical center visit, $295. Emergency room, $90 copay. If they have an ambulance ride, $275 on the ground and 20% through the air. Pretty standard stuff here. Urgent care, $35. Diagnostic radiology testing will range from $150 to $215, just depending upon the service. Same thing with diagnostic procedures and tests, $70 to $160. X-rays, $50 to $110. And that lab work will range from $0 to $20. Dental, it's going to be no comprehensive dental, more preventative. So 2 oral exams, 2 cleanings, 1 X-ray, and 1 fluoride treatment. Silver Sneakers is included on all of our plans, so that will be available. They will also have access to a $3,000 hearing aid benefit. And that OTC Walmart card, they will get $50 a quarter to spend at their local Walmart, or they can order online, or they can call and order via the phone. Podiatrist unlimited visits, and they also will get $150 toward eyeglasses or contact lenses. So this is a great plan. We think it's gonna sell like gangbusters throughout the state of Indiana. key thing to note there, if your client has LIS, $0. They do get some OTC and some vision benefits on that, and it is available in that Wayne County area, so I think that can be really helpful over there. So now let's move along to where Anthem really strives forward is our HMO product line. And we do have 3 different HMOs throughout the state of Indiana. But first, I'm going to talk about the 021 and the 022. Side by side, they're very close and very comparable, so I'm going to do those all at the same time. The MOOP on these 2 products has dropped from $4,900 to $4,400. That's a big win for Anthem. PCP and specialist copays remain the same at $5 and $40. No changes on the inpatient hospitals. The 021 is $295 and the 022 is $305. No RX deductible on the 021. $120 deductible on the 022, but then again, only on tiers 3 to tier 5s. Both plans have $2 and $9 copay on tier 1 and tier 2, and the tier 6 is available on both of these as well. And the thing that I want to talk most about is something that Anthem tried last year. They tried to shift the outpatient surgery to a co-insurance, and we heard the brokers loud and clear. It's not something that you wanted to stick your clients in for the uncertainty. So Anthem has shifted back to a copay structure. Big win, $275 for outpatient surgery at the hospital. Last year we had a co-insurance, so big improvement there. The other thing to notate is the lab work has shifted from $15 on the high side down to $10. No other changes as far as the emergency room, ambulance, urgent care, diagnostic procedures, or radiology. The dental is staying the same. Essential extras are remaining on all of our HMO products, and we're going to go a little bit deeper. I actually invited a product specialist that's helped design and implement all of the essential extras to kind of dive in a little bit deeper, because I do think that's something to where Anthem sets itself apart from our competition. So I want to make sure that all the agents have all of the tools and resources available to you to sell every potential member in front of you. And I think you need to learn a little bit more about essential extras. I know if I was an agent, I would want to know a lot of the ins and outs of essential extras so I could discuss that with my potential clients. So I've invited Andre to talk a little bit later about that. As far as silver sneakers, staying on all of our plans, like I mentioned earlier. Post-discharge, 20 meals after hospitalization, remaining with GA Foods. The $3,000 hearing aid benefit is intact. The Medicare Community Resource Program is staying on all of our plans. And the over-the-counter on our HMO products is $70. I believe last year was $75. We made a little shift there to $70 in order to get that lab work down to $10. As far as the PERS, it is covered, and our vision allowance is $150 on both of these plans. Now for the 023 HMO, this is going to be in your Marion County and surrounding areas. Zero premium, obviously, $5 and $40 for the PCP and the specialist. The inpatient hospital has dropped down to $295 for days 1 through 7. The MOOP on that plan remains at $4,900. The RX deductible stays at $75 for tiers 3 through 5. Tiers 1 and 2 copays stay at $2 and $9. Tier 6 still included. And all those key extra benefits, the dental, essential extras, hearing, live health online, meals, Medicare Community Resource, PERS, nurse helpline, OTC allowance, silver sneakers, and vision have all remained unchanged. And like I said earlier, on the other 2 HMOs, that co-insurance on that outpatient surgery is going to a copay. We'll breeze through that, pretty much the same as the other 2 plans. That takes us to our HMO Extra. So for you that aren't aware, we do have a plan that kind of fits in between our HMO and our HMO DSNP. This is really designed for your members that are receiving 100% LIS or are SLMB. There is a premium that's attached to this plan. You notice on the top left-hand side of your screen, if your member is not receiving LIS, then it will be $29.60. If they're receiving any form of subsidy, you'll see that premium goes away, but if they're receiving 100%, it will be $0. So it's really designed for your clients that are receiving 100% LIS. Not saying that you can't sell somebody that's selling, getting 75 or 50% because it does make sense in those spots. But the real sweet spot for this HMO Extra plan is going to be people that are receiving 100% LIS and or are SLMB. People that are SLMB are not eligible for the DSNP plan, so they would be eligible for this plan, and it just kind of gives them an enhanced version of the HMO. The specialist copay on that did drop down to $30. The PCP stays at $0. Inpatient hospital dropped down to $290, so big wins there. And you notice that if they are not receiving LIS, there was a shift on some of the copays as far as the RX preferred copay structure goes on tiers 3s and 4s. And we did up the dental allowance to $250 a quarter. So that's $1,000 a year. That will roll quarter to quarter if they don't utilize it. So that'll give them $1,000 at the end of the year. And the way that works, in the first quarter, they only have $250 unlocked. Then it unlocks another $250 in the second quarter, another $250 in the third, and then another $250 in the fourth. So they won't be able to tap into that full $1,000 in quarter one. They only have $250 available to them. So if they have something big that they need done, you might want to tell them to wait until the fourth quarter to do it, because only $250 is allocated for quarter one. As far as the transportation, 24 one-way trips. And as far as the vision goes, that has been up to $200 for glasses or contact lenses. And now to our DSNP. So a lot of improvements to our DSNP product. Obviously, they're not going to have any copay structures on anything that they do as far as their medical. RX unchanged. Obviously, those limits are going to fall in line with the rest of the state. But our dental has gone from $2,000 all the way up to $2,500. So that's a big win. All the other benefits remain the same: essential extras, silver sneakers, post-discharge meals, $3,000 for hearing aids. All of that stuff remains untouched. We are going to get $315 per quarter for that over-the-counter. I don't know about all you agents out there. If you haven't sold our DSNP, you're going to get a lot of referrals because of that $315 going to Walmart and being able to get the supplies that they need, vitamins and different things to keep them in good health. Personal emergency response system is offered to all of your members, and that device is at no cost, as well as the monthly fee. They will have unlimited trips to the podiatrist, 48 one-way trips to and from the doctor, and as far as the vision goes, $275 allowance for the year to go toward eyeglasses or contact lenses. One other great thing about our DSNP plan that is transferring over, and it was piloted in the state of Indiana. We had so much success with it last year that we're rolling it out in 2021. They will reward members for taking care of themselves. We'll give them a $100 gift card if they schedule a regular in-person annual routine physical and annual wellness visit with their PCP. Or members can schedule a telehealth visit if offered by their providers. So we know that COVID has kind of changed the landscape of a lot of seniors being able to go into their doctor's offices. But if they do that annual routine physical or annual wellness visit, we will send them a $100 gift card. So that continues into 2021 on our DSNP product. All right, so that brings us to Essential Extras. The Essential Extra package is something that's very unique to Anthem and sets us apart from our competition. It is available on all of our HMO products, but today, instead of me talking about the Essential Extras, I wanted to bring in the product specialist that's helped design and implement all of these benefits, and his name is Andre. Thank you for being here, Andre. We appreciate you taking some time out to help educate our broker field so they're better equipped to sell to potential members utilizing the Essential Extra package. Take it away.
Well, my name is Andre Vlasovich, and I'm with the product team here at Anthem in the Medicare organization. And I'm here to talk to you a little bit about the 2021 supplemental benefits that we'll be rolling out, and see if hopefully we can get your questions answered up front and help you in your process to go sell going forward. The first thing I would like to do before we get started is do some level setting with some key terminology, just so that I don't go off talking about some things and lose people here. But As I said, we're going to be talking about our supplemental benefits, and as most of you know, there are two kinds of supplemental benefits out in the market today. We've got your mandatory supplementals, which are MSB, and your optional supplementals, which are OSBs. The biggest difference between those two is your mandatory supplementals are included in the plan itself as part of the plan for whatever premium is required, and your optional supplemental benefits are additional benefits that members can purchase if they so choose, but they need to pay additional premium for it. Now, beyond that, I need to give you a little bit more about the MSBs that we roll out. We have really two kinds. The standard kind is what we call embedded, and these are things such as your dental, your vision, and your hearing that most everybody is pretty familiar with. But we also offer our essential extras or everyday extras, depending upon what market that we're in, that this is a mandatory supplemental benefit, but this is where we give the member an opportunity to tailor their plan to exactly their needs. And in 2021, we will be giving them an opportunity to pick one of 9 options to select a benefit that is best suited for their particular needs. The other thing is that we've put a lot of our energy in the last few years in taking advantage of CMS's expanded scope of health-related benefits called social determinants of health. And this is where we have benefits that take into account social factors, physical factors, health services, biology and genetics, or even individual behaviors of members and their impact on a member's overall health. This is different from some of the more traditional ones, which are really focused on more traditional medical impacts on members' health. The expansion of these benefits in 2019 originally was a new frontier that CMS opened, and Anthem truly took advantage of it, introducing essential extras originally in 2019. And we've continued to go ahead and expand upon those benefits as we've gone forward. But CMS has also given us new opportunity, and with that, also some new guidelines that we have to continue to manage under. And one of those is they've given us the opportunity to go kind of a little more wild, but they've also made sure that anything that we're doing, we can tie back to a chronic condition that the member has. And in this case, they're called special supplemental benefits for the chronically ill, or SSBCI. And as I get later in this presentation and talk to you specifically about some of the benefits that we have available, some of them may only be available to a member if they meet the conditions outlined by CMS as having a chronic illness. And those conditions are listed here. They have one or more comorbid and medically complex chronic conditions. They have a high risk of hospitalization or other adverse outcomes, and their care requires intensive coordination. So when we get into this later and we talk about benefits being available or requiring a SSBCI pre-certification, this is what we're talking about. So the next thing I want to talk about are some key changes that we're going to be doing for 2021. So the first of those is that alternative medicine as one of our benefits in essential extras is going to be discontinued at the end of this calendar year. Now, we know this has been a popular benefit amongst our members. However, there has always been some challenge getting enough providers in the network to really make sure that we had the robust options available to our members. But also, just this year, Medicare started covering acupuncture, especially for lower back pain, which is one of the most common conditions that people go in and request acupuncture for. So it sort of negated the whole need for this, and therefore we made the difficult decision that we will be discontinuing it. Now, for those of you who have members who selected this benefit, we will be reaching out to them in probably, I believe it's late September, right about the times that they receive their ANOC, to let them know about this specifically and give them the opportunity to select a new benefit for 2021. Another major change that you're going to see for 2021 is a change in the vendors that we use in a number of our markets for non-emergent medical transportation. So this benefit, the transportation benefit, is a very popular one with members, but it's always been very difficult to make sure we're getting the service that we want from these vendors. So there have been some shifts in the vendor landscape here, and you'll have to look by market. In most cases, we'll be using a vendor called Access to Care, or A2C, but please go ahead and get specific information on the vendors in your market that we'll be using. The third change I want to address is that we will be renaming some of the benefits that we'll be implementing in all of our markets. And this is because when we first started doing SDOH benefits, our group CareMore, which is predominantly out in our West region, had implemented some parallel benefits to what we've been doing, but they named them differently. So we've done a lot of work to standardize both the design of the benefits and the naming, and you're going to see some of the same benefits with some new names, and I'll cover that in a following slide here in just a minute. Next change is to let you know that our over-the-counter benefit has been insourced. We've been using a vendor. We'll continue to use the same vendor to support that benefit, but we've decided to improve service to our members to actually bring the call center in-house. So we began that transition actually this past May, and it was finished in just this July. So that has been, we've had an opportunity to get folks' teeth cut well in advance of AEP, when we expect a lot of phone calls from our members around either finishing off benefits for Q4 or with questions about getting their new benefits set up starting in Q1. So those are some of the key changes that we'll be implementing around our supplemental benefits. Let me kind of dive into a couple of these a little bit further. So first, let's take a look at the benefit renaming. The benefit renaming, as you can see, is listed here. Some of this may not seem like a change. It may not actually be a change for you, but in other markets it might be. So for example, adult day center and day center visits were essentially the same benefit in different markets, and we have now standardized on one name for all that benefit called adult day center. Healthy food deliveries, which was one of our essential extra benefits, has now been named Healthy Meals. And then some of our standard benefits for post-discharge meals or chronic meals have all been renamed as well. So now as you can see, we've created a pattern here. So we have Healthy Meals post-discharge or Healthy Meals chronic condition. So anything where we have a prepared meal that we're offering to our members as part of a benefit, we've tagged with this Healthy Meals name. The Healthy Nutrition benefit, which is part of our Essential Extras benefit, also known as Prescribed Nutrition in some of our other markets, that has been renamed to Healthy Pantry. We've also, by the way, made a slight change to that benefit, where previously we were offering up to 8 telephonic counseling sessions, nutritional counseling sessions to go along with that benefit. And now we've basically changed that description to give them monthly telephonic nutritional benefits for the members. And then finally, for the personal care services that we offer in a number of markets that went under 3 different names in the past, and we've all standardized those to Personal Home Helper in all of our markets going forward. So just know when you start hearing some of these names that are a little different, they may be tied to the exact same benefit as you had previously. So kind of going back just to make sure that nobody's concerned that we're getting rid of any of our oldies but goodies in the MSB category. And also just to talk about the various vendors that we actually do use for these benefits across the country. You do need to check and find out which we're using in your specific market. For your OSBs or your optional supplemental benefits, there have been no changes for 2021. This, of course, is on top of whatever they might have as their MSB. So if a member chooses to buy up for this and pay the premium, that's what they would be getting for this. Also important to note that if they do purchase this benefit, there will be no utilization management on the dental, regardless who their vendor is. Okay, so now I'm going to go ahead and jump into a little bit more about some of our benefits. The first that I would like to talk about is Medicare Community Resource Support, or MCRS for short. You will actually find this as a benefit in many of our plans, but it is a program that we will use for any member in any of our plans that we have. And basically, to me, this is a fantastic service that Anthem does, where we actually have a group of social workers who work an outbound call center. And if a member is having an issue, a problem, something that goes beyond what their healthcare plan can help them with, this group of social workers is got a database full of programs, state programs, local programs, community programs, church programs, all across the country. And they work with our members to try to help them connect to one of these programs for help in almost any area. It might be they need education. It might be loneliness. It might be car repair. It might be housing related. It might be that they need a wheelchair ramp or service or maintenance in their home. Whatever it might be, this group will work and try to help connect them with a program that could offer them some assistance. Now, it's not a huge group. This is not an inbound call center. You can't just call them. So the way this is set up is it's a referral in program, and then the program will the social workers will do outreach. My suggestion to you is if you find a member who you think could have benefit from help from this program, either ask them to call member services, or you can contact agent services and they can refer the information into the MCRS team for you. So a fantastic program. A couple of the examples that I like to always tell, and I probably repeated this story more times than I can count, but I love them, is one time that we had a member who needed a wheelchair ramp built for their home. We connected the member to a church organization that built that ramp even before they got home from the hospital. So by the time they got home, they could start to work on getting their house adapted to their new environment of having a wheelchair. And the funniest story that I like to tell is we had a member who ran out of their transportation benefit. You know, the transportation benefit only has so many rides, and they ran out of their transportation benefit, and they were calling and asking if they could get more because they needed to go to their doctor's appointments. And in doing so, the member services rep discovered that the member's car had broken down and she just couldn't afford to get it fixed. So we referred her into MCRS, and they actually found a local school that needed cars that required service to teach budding mechanics, people who were learning how to be mechanics, a trade school, to fix the car. And they were basically able to fix the car for, I believe, just the cost of parts and a nominal fee. So this 80-year-old woman is back on the road driving to her doctor's appointments and doesn't need her transportation benefit anymore, and everybody was happy. So a great program, something we want to continue to do for our members. So just please be aware that it's out there in case you ever come across a member who needs help in this area. The other thing before I get into a little bit more about the essential extras or everyday extras benefits that I'm going to review here, just kind of give you some stats on the program itself. So we on the left-hand side of the screen, I just thought we might find it interesting, just based upon what members select. The number one leader is transportation, with basically, if you look at those last two rows, over 20% of our members have selected additional transportation benefit. But what's really exciting is to see the health and fitness tracker benefit. We've had 18.7% of our members select that benefit, and that benefit was just introduced in 2020. So that has been definitely the number one benefit in 2020, but across the history of the plan, transportation is still number one. Okay, so now I'm going to kind of go through a question that's come up a number of times, and I think might help you in helping to manage the expectation of your members is when a member has essential extras and they make a selection, what happens? So I want to walk you through the process so that you can help your members understand what to expect and the timing of some of each of these steps so they know when they can start to access their benefits. So first of all, let's talk about the selection itself. The selection itself they can make their selection if they're a new member on an application as they're applying. So there will be a box on the application for them to select their interested benefit, and there'll be some other information that's requested as well. We also have a dedicated form that can be faxed in at any time to member services to get the member's selection. That form is available through Custom Point, so that can be obtained by you at any point. And of course, the member can just call member services and make their selection as well. Shortly, I understand the selection process will be available through the member portal, but I don't know if that's going to be available before 1/1 yet or not, but just to be aware that is potentially coming. Now, it's important to point out that members aren't required to select any benefit, and when they do select the benefit, they can select it at any time during the calendar year. So if they want to speak with their doctor, get some information first, or if they're under care and they want to speak with their care manager, please encourage them to do so. There really is no rush, and it will not hold up the enrollment process. Okay, that's the most important part. It will not hold up the enrollment process. They can get fully enrolled in the plan and then go ahead and make their selection at any time. For some of the benefits, there is a pre-certification requirement, and this is where we started talking about SSBCI. I'll come back to that. So while the process I'm going to outline here is basically kind of 3 steps, not every member will go through all 3 of those steps. Some may go through 2, or some may go through 3, depending upon which benefit they selected. And the last thing I wanted to let you know is, once they make their selection, they will remain in that selection really until officially until the end of the plan year. But a lot of times we have been reauthorizing anything that required pre-certification automatically. We'll be doing that again for 2021 members. But members are allowed to change their selection during the calendar year. But there is a proviso, and that is that they cannot have utilized their benefit at all. So, for example, if I have selected transportation and I would like to switch to assistive devices, which is another one of the benefits, I can't have started to use any of my transportation rides prior to making my change request. Otherwise, I'll have to wait to the end of the calendar year to go ahead and make my change. Just to clarify, this would be whether or not they've used any of their additional transportation, not their base. They could, if they had 24 base and they chose 60 additional and they realize they're not going to need it, and they want to change, as long as they haven't gone over their 24 base, they'll still be able to make that change. Okay, so members made their selection. Selection's in place for the year unless they request a change. What happens next? So the next thing that's going to happen is probably 3 to 5 business days, I would imagine, after the selection is received, and that the member should get a confirmation letter indicating that we've received their benefit selection. Okay. Now, if the selection that they made does not require any pre-certification, that confirmation letter will give the member instructions on what to do next to begin to access the benefit. If the member's selection does require some form of pre-certification, then we need to basically, the letter will tell them that will confirm that we've received their selection and let them know that their application is now undergoing pre-certification review, and they'll receive a final confirmation. It's really, really important that you please make sure your members understand that until they receive the letter that tells them they can start accessing the benefit, in some cases it's the first one, in some cases it's the second, that they don't try to access the benefit before then. Just from the standpoint of when we get the member selection, we oftentimes have to send information on the member to a vendor so that the vendor knows that this member is eligible for the program, or that they've completed or not completed the pre-certification process. We cannot offer the member the service until we've completed those processes. So The letter basically will is the members and green flag to go ahead and start accessing their benefits. So please understand that, and if you can, please help us in setting that member's expectation appropriately. So this is the process they'll go through. If on that third step, if they does have to go through pre-certification, I believe it takes roughly 10 business days. It's called an org determination as determined by CMS. And so it takes roughly 10 business days for us to do that. And again, that member should be getting a letter when that process has been completed. So that also has to go through the mail for the member to get it. So 3 to 5 business days for the confirmation letter, and then potentially another 10 business days for pre-certification if that's what's required. Okay, so now I'm going to run through the 2021 essential benefits, essential extra benefits here. Again, remember there are 9 of them. They have not changed from last year, but I'll go through them just to review them with you guys anyway. So transportation, again, this is additional transportation to whatever they might have in their MSB. We give them up to 60 one-way trips to any plan-approved location. That includes going to their pharmacy. That includes Silver Sneakers locations. There is no pre-certification requirements here. We do ask that the member call and schedule their trip 48 business hours in advance, and there is a 60-mile limit each way on the trip. So please be aware of that and make sure your members understand that as well. Healthy meals, again, this was called healthy food deliveries previously. This is where we give the member up to 64 additional pre-cooked meals, medically tailored meals based upon a set of criteria. Now, to select this benefit does not require any pre-cert at that time. But when the member is ready to ask for meals and they call into member services, they'll be referred into the pre-cert team, which will have to validate either a post-discharge within the last 30 days, that the member has a body mass index of less than or equal of 18.5, which is sort of an underweight condition, a body mass index of greater than or equal to 25, which is an overweight condition, or an A1C greater than 9, which is a diabetic condition. So those will have to be validated to be eligible for the meals. If they have a post-discharge meal on their normal plan and they select healthy meals, they can layer both of them on a post-discharge event if they want more meals. There are some members who choose to do that. Personal home helper, this is where you have a personal care assistant that will come into a member's home and help the member with activities of daily living. Activities of daily living are things like dressing, eating, grooming, bathing, toileting, incontinence, mobility within the house, and things like that. The member this does require pre-certification. We do need to get information from their doctor that says that they need assistance with at least 2 activities of daily living in order to qualify the member for this. We give them up to about 124 hours in most plans per year. No more than 4 hours per day, up to 31 days is how that really breaks out. We work with a variety of agencies. After the member is certified for them, we connect the member with one of those agencies to help staff that. This is not a skilled nursing, in-home nursing benefit, just so that you know, these are personal care attendants. They're unskilled. They cannot help with medication other than to remind members that they need to take it. So they can't do any skilled nursing. It's all just sort of personal care type assistance. The assistive device benefit, this benefit was built to help members basically live more comfortably and more safely in their own home. Sometimes, members just want to stay in their home, but they need to be, their condition is such where they need some assistance. And what we're doing is we're offering about $500 per year to members in most plans. There's one, I think that's less than that. But up to $500 per year to purchase devices, things like grab rails, ADA toilet seats, transfer benches, bed rails for their beds so they don't fall out, reading devices, reaching devices, things like that, just so they can live more safely. We do this through our vendor Solutran and Walmart. You can't buy this these items in stores. They have to be purchased online just because they're very unique items. But it's essentially the same vendor, and in fact, the member will actually get the same card. The one card, kind of like your ATM card, will work for both the assisted device and their OTC benefit in this particular case. And there are no pre-cert requirements here. The next benefit is Adult Day Center. This is another benefit. This was called Day Center Visits previously. It does require 2 activities of daily living that we have to certify the member needs. And in this particular case, what we'll do is we'll give them a day a week at a day center of their choice, so long as that day center is certified, licensed appropriately by the state. So whatever the state's licensing requirements are to operate an adult day center, that center must meet that, and we will check that for the safety and health of our members, as well as our protection. The way this is set up, there is no network. It is set up on a direct member reimbursement program, a DMR. So the member would have to, we'll pay up to $80 per day, but the member has to submit for reimbursement from us. If the day center is willing to do this on the member's behalf and take the member out of the middle, that's a wonderful thing, and we can help accommodate that as well. And there'll be instructions with our provider services team that can help the day center in setting that up. We also will provide transportation to and from the day center with the same vendor that we use for a normal transportation benefit. It does not take away from any of their normal transportation rides. This was specifically dedicated for this benefit. It's separate. They can't make other stops. It's just to and from the day center on the day of that they're actually accessing it, and there's no charge to the member for that. We get that directly billed to us. Again, 48-hour advance notice, business hour advance notice, and 60-mile one-way trip limit do apply. Okay, health and fitness tracker. This is the benefit that I told you is just absolutely taking off this year. We're excited to be offering it again next year. This is a three-part benefit. So no pre-cert requirement on it. What we're doing is we offer the member basically a fitness tracker device, Fitbit type device, and currently today we're using a Fitbit. Those things change as new models come and go, so we may not be in the future, but it's essentially one of those devices, and it will be a quality device that we'll be offering to our members. So they get that for no charge. They can get one of those every other year. But then we're also offering access to 2 online websites. One is a site called Walker Tracker, where the member can upload their steps from their Fitbit or tracking device. There'll be challenges and things to engage the member, and this is really to provide encouragement and coaching and advice on how to get moving and get walking, and give them something to give them some goals so that they can go after and do that. So we ask them to sign up for that, and then also because the recent AARP article that I was reading about members, seniors who are not doing a whole lot during COVID, and they basically liken the brain to a muscle, and it atrophies. So we also offer an online set of games that have been developed by neuroscientists to basically engage a member, and they're really exercises, but they come across as games. But these exercises basically help members with memory, focus, attention, and all the things that will help them on day-to-day living. So they automatically set themselves to the member's level, and then they help the member progress from there. So pretty neat 3-part benefit with Health and Fitness Tracker. And then the last 3 benefits, these are all going to have some pre-cert requirements under SSBCI, like we talked about, special supplemental benefits for the chronically ill. The first one is pest control. So if a member is got a chronic condition where the spread of germs, for example, in their home could put them at risk, they could qualify for this pest control benefit. And the standard benefit that we offer is a quarterly treatment of common household pests such as cockroaches, ants, mice, things like that. Bugs of various sorts, and they'll come in on a quarterly. Our vendor will come in on a quarterly basis and treat the member's home for that benefit. If in some cases we have an issue with the member has a significant issue with, say, bed bugs or whatnot, and again, a chronic condition could be tied to the issue of bed bugs, then that is something we can review, and we ask that up front the member ask for the one-time treatment. We can't offer both. It's either the quarterly treatment or the one-time treatment that we can offer for the member. Now, another piece to understand about this is where the member lives is very important to this pest control benefit. If the member is in an independent living center or condominiums or townhomes where the association or the management company is responsible for that those services, we can't offer that. So we have to defer to the management company there. So it has to be the member's own home. We have to be one that we can get in there and actually service that legally. The next benefit is Healthy Pantry. This was called Healthy Nutrition previously. Now, this is a benefit whereas we talked about healthy meals, where we offer pre-cooked, medically tailored meals for members. This benefit is really geared towards helping members make longer-term changes to their diet. So there's two parts to the benefit. One is, and again, for members with chronic condition, where we know that a change to their dietary practices will actually help their chronic condition. We will offer them monthly telephonic nutritional counseling sessions with our internal staff to help them identify where they want to focus on making some changes and then help them implement those changes. But then what we'll also do is we'll send them a monthly box of pantry staples, foods that's non-perishable, things like pouched or canned meats, spices, grains, things like that, as well as a bunch of everything that can be stored in your pantry as opposed to a refrigerator or a freezer is fair game. And what the goal is here is that we will be giving them examples of the foods that we're suggesting that they try, to help prompt both trial and adoption of those changes and help them to stick long term. That's the goal of what this benefit here is done. It's a monthly box of food, probably $35, $40 worth of food every month that we would send to the member. Again, it will also come with recipes and tips and tricks and other things to help members make those long-term dietary changes. And then the final benefit I want in the Essential Extras portfolio is service dog support. This is for members who have an ADA service dog. Now, there are other types of support animals, emotional support animals, even other types of therapy dogs. We cannot include those types of animals in this program. And what we do is we provide up to $500 for members towards support of that animal. So that includes the food, snacks, treats, bedding, grooming care, not the grooming itself, but things you could buy at Walmart, brushes and shampoos and flea shampoos and things like that, vests, leashes, all that kind of stuff. We use Solutran and Walmart in this partnership for this. And again, some of these items are available in store. Others are going to be only available online if they're more specialty for a service animal. And again, we have to know that the member does have an ADA service dog for this. One other thing is that this does not pay for the dog, vet bills for the dog, or actual grooming for the dog. It's just all the supplies and things like that to help support the animal. So that's the summary of our 2021 essential extras and changes to our supplemental benefits. I hope this was helpful for you. If you have questions, please contact your Anthem sales support representative, and I'm sure they'd be able to be willing to help you. And thank you very much, and we hope you have a great day.
Hey, thanks, Andre. That was great. A lot of helpful information. I think a lot of that stuff is really going to help our brokers in the field be able to better communicate these product offerings to their clients. So that does conclude all the information today. Those of you that have more questions, please feel free. We will stick around to answer any questions via the chat. Those of you that are jumping off, thank you so much for joining us today. We look forward to partnering with you during the 2021 AEP and lock-in season. If you need anything at all from Anthem, please do not hesitate to reach out to your regional sales manager or myself personally. We're here to help. And again, thank you so much. Take care.